Good evening, everybody, and you're very welcome to the third Rare Disease Forum. And as you know, the theme of tonight's forum is on partnership and partnering. And in that context, it's very appropriate that we have a partnership which oversees and coordinates the Rare Disease Forum. And that includes Rare Disease Ireland, the Northern Ireland Rare Disease Partnership, Health Research Charities Ireland, IPPOSI, and ourselves, Cystic Fibrosis Ireland. So tonight, as I said, it's a focus on partnering and partnership. And tonight's agenda very much reflects the different levels and types of partnerships that are involved in rare diseases, including one of the most interesting developments in recent years has been the partnerships at a political level to try and advance the rare disease agenda at a European level. And we're going to hear later from Caitriona Creely from the Health Research Board, who's going to focus on two very interesting initiatives at a European level. And from partnerships from a patient and patient group perspective, and we've Alan Finglas from MSD, who's going to give a very interesting look at that from his experience. So it's a really important lineup, and in future we'll probably look at other types of partnerships, like partnerships with industry and the pharma industry in particular, and academics. But I was at an event today which I think really brought home to me how important partnerships are for encouraging and developing the rare disease agenda. And I was at the launch of the National Traveller Health Action Plan. And many people would know that the traveller community in Ireland, there's about 60,000 travellers north and south. Rare disease is a particular issue for that community, and a strategy like the National Traveller Health Action Plan will be of great importance in terms of addressing the rare disease agenda for that group. And indeed, there are other minority ethnic groups that have particular rare diseases need to be addressed. I can think of the Asian and African communities in Ireland, and sickle cell and thalassemia, which is a really important issue, and that's currently being discussed in terms of newborn screening. But the launch of the plan was really important, and I think it brought home to me the absolute crucial fact that we don't just work together as patient groups with each other, but we actually partner with statutory and academic and industry organizations. And this strategy basically came about through a research study that was undertaken by UCD by Professor Cecily Kelleher in 2010. And that was in turn, the reason why that research happened was through the lobbying of groups like Pavy Point, the Irish Traveller Movement, to get that research actually undertaken. And out of that process, there was a number of initiatives which have improved the lives of travellers over the last decade, including the establishment of, for example, of traveller health units. And today, the action plan was the next step in that process. So it can really show how partnerships can really influence the agenda. And of course, I mean, we had 3 government ministers at the launch today, and the involvement at the political level, the involvement of politicians in not only understanding the rare disease agenda, but also helping us to move the rare disease agenda on is so important, particularly in the context of the potential of national plans and the potential for European reference networks at a European level. It's absolutely crucial that we involve other stakeholders, including politicians. So in terms of scene setting, I am absolutely delighted to welcome the next speaker, who is Dr. Derek Mitchell, and he's the CEO of IPPOSI, who've done great work in terms of helping to move the rare disease agenda on, and they are the lead group for tonight's forum. We'll be taking in turns to organise each forum meeting. So, Derek, you're very welcome, and over to you.
Thank you, Philip, and thanks indeed for your chairmanship of the Rare Disease Forum this year. This is our third event, as you said, and I'd just like to thank everybody who's been involved in the organizing of all three events, our February, our May, and now our November event. And I'd like to thank all of the partner organizations involved in the steering group. I'd like particular thanks to the IPPOSI staff who are facilitating this evening's event. And I guess the format of the event is that we have a lineup of speakers, as Philip have said, from political, scientific, and indeed healthcare perspective and patient perspectives. And it won't be presentation heavy. It'll be short, brief interventions from each speaker, and then we'll go to a panel discussion. And I'll be facilitating that, but we'll also be encouraging everybody to use the chat function to post questions that might come to mind as people are speaking, or indeed during our discussion. IPPOSI are also conducting a Mentimeter, and that's a survey that we'll be posting through the chat, and we'll be interacting with people all along. So we'll be monitoring the chat quite frequently, and hopefully we'll get to all the questions within the time that we have. But as Philip has said, I think tonight's topic of partnerships, it's quite appropriate that IPPOSI is I guess the convener of this, seeing as not only is the Rare Disease Forum a partnership, but so too is IPPOSI, and anything that IPPOSI has achieved over the years has been in partnership with others. So the Rare Disease Forum, of course, is a PPI partnership, so it's patient and public involvement, and we want to see how we can move through PPI and through other initiatives, how we can move the rare disease agenda forward. And we'll be getting in under the skin a little bit about what we mean by trusted partnerships through our discussion and indeed in IPPOSI activities next year. But if I focus on the Rare Disease Forum just for a second, in terms of that partnership, it is a cross-border initiative. It is across patient umbrella groups. And now the steering committee have taken the decision to include lived experience on the steering group, and we're announcing that tonight, that the steering group is being expanded to include 2 people with lived rare disease experience to join the group as full members and to contribute to the work plan of the forum. And essentially we're looking for people either living or have a rare disease, or if you're a parent or a carer to someone with a rare disease, or might otherwise be living with a rare disease. So, and we would hope that this work would be enjoyable and that people would learn from the experience of working collaboratively with other advocates as part of this cross-border initiative. There will be a commitment, and that time will be remunerated according to IPPOSI policy for PPI opportunities. So we are announcing that tonight, and it will be disseminated through all of the channels that the partner organizations have, and indeed to the registrants of today's event. So look out for that. And then just in terms of the topic of trusted partnerships, well, we are at the for the first time in Ireland, we're talking about the establishment of an Oireachtas cross-party group in the Republic of Ireland to focus exclusively on rare diseases. And we have 2 people from the political spectrum here, and we are delighted to be joined by both Padraig O'Sullivan and McHugh from the Republic and Northern Ireland, respectively. And I'll be asking both of them to speak about their experiences of bringing political attention to rare disease agendas. Of course, partnerships are not restricted to political agendas, but we're also going to be talking about healthcare partnerships, predominantly in the context of the European reference networks. And we have very educated, informed patient and parent in Alan Finglas, and Alan will be talking about his experience of the ERN in his area. And then we have Katrina Creely from the Health Research Board, who will be talking about some of the European research-focused initiatives, but also with applications for the Irish healthcare system, because fundamentally today is all about how we can collaborate better in Ireland at the national level to advance a national rare disease agenda. And nothing is reflected more at the national level in terms of rare diseases in Ireland than our rare diseases plan, which in itself was developed through a partnership of patient groups, of health service delivery, of health policymakers, of health researchers. And the plan has been in existence for a number of years and is in the programme for government. And if anybody's interested in learning maybe from an update perspective, I would point you in the direction of our Easy Guide for Rare Diseases, which was again created in partnership by the predecessor of the Rare Disease Forum, and that was the Rare Disease Task Force. So with that, I'll kick things off from a presenter perspective, and just to say that we will be monitoring things in the chat, and please feel free to use it. But I'll turn to our first political representative, and that's Padraig O'Sullivan. Padraig is the Fianna Fáil spokesperson for special education and has been a TD in Cork North Central since the 2019 by-election. Padraig's key priorities include health, education, housing and planning, and he currently has a bill before the Oireachtas. That's the Health, Pricing and Supply of Medical Goods Amendment Bill 2021, and this bill will establish a new structure for Irish health authorities to assess, approve and reimburse what are orphan drugs for rare diseases. So Padraig, if we could have your perspective on the topic of partnerships.
Yeah, just thanks for the intro there, Derek. You forgot to mention that I'm big into childcare as well, so apologies in advance if you can hear screaming children during the next hour, but bedtime will be coming up in the next 45 minutes. So no, look, I'm delighted to be here again this evening. I've done a number of these types of workshops and forums over the last number of months, and I recognise many of the faces in front of me at this stage, which, you know, is great, but it's also quite sad, you know, because in that 12-month period where I've got to meet many of these people that are on the call tonight, I suppose, you know, if you're to set yourself targets and to gauge how progress is being made in this front, you know, if I'm being very truthful, the progress has been painfully slow. And I know we're coming up to a critical time where, you know, there's possibly a reshuffle in the Department of Health ahead of us. But there's also some minor movements, and the one that interests me the most is I've recently been given a commitment by the Minister for Health that the Mazars report will finally be published. I know that a lot of people are interested in the content of that report, and I'm hoping that that will, you know, I suppose give us an idea of, you know, the whole reimbursement model, what's working, what's not, and, you know, where we as a society need to progress and improve. In terms of partnership, if I'm being, again, fairly blunt and honest about it, since I got involved in this topic nearly 2 years ago, the one complaint, I think, particularly with my engagement with patients groups, the one complaint always from their perspective was a lack of transparency in, you know, between themselves, I suppose the patient groups and the Department of Health and the NCPE. So, you know, this evening's chat is about partnerships, but for me, the one, I suppose, stark instance that we have down the south anyway, I'll let Maolíosa speak from the north, is that, you know, that spirit of partnership, I still think it's something that we need to foster and to nurse, because at the moment, you know, I do find that myself, there's a lack of transparency in the system. Look, I've been studying other countries right throughout Europe and meeting, you know, a variety of organizations, public and private, and from pharma and so on. And it just astounds me, some of the stuff that happens on the continent in particular, and the EU 15, and how we as a country down here, who are quite proud and rightly proud of our manufacturing industry, particularly in the pharma side of things, we don't reap the benefits fully, in my own opinion. And there's so much more that we can do in fostering partnerships with industry and pharma in terms of delivering best returns for patients. I don't want, I suppose, to overemphasize the importance of just the bill and the reimbursement process just for drugs, because I actually recently met Anne Lawler, I think she might be on the call tonight, I suppose she opened my eyes to just how important, the whole care side of things is as well in the community for patients. And I suppose we mustn't lose perspective on that as well. So I'm sorry to open on such a negative, pessimistic tone, but that's my own experience so far in the last 18 months. I do believe we can do an awful lot better. And when you go on to Maolíosa there, I think things up the north are moving at a greater pace, but we're finally coming into a position in the south where we will have that established Oireachtas committee. We had hoped to do it much sooner. Apologies to everybody for the delay in that. The most recent delay is to do with John Lahart, TD's personal health. He has agreed to chair the initial meeting of that, so that's also been delayed. So we will be hoping to meet, at least in political circles, before Christmas, and then I suppose with a view to actually having our first meeting proper in January, February of next year.
Thanks, Paddy, and I certainly hope by the end of this evening that you'll be looking a little more positively on things, but maybe not, as the case may be. But with that, I'll introduce Maolíosa, and you're very welcome, Maolíosa, for joining us. So Maolíosa was elected in West Tyrone in the same year as Paddy in 2019, and is from Sinn Fein, and he's also so Maolíosa is obviously a member of the Northern Ireland Assembly, and is the vice chair of the equivalent all-party group that Paddy was mentioning in rare diseases in Northern Ireland. So Maolíosa, would you like to give us your perspective on today's topic?
Yeah, good evening. Just as I say, my name is Maolíosa McHugh, and I'm the Sinn Féin MLA for West Tyrone, and I'm delighted to be invited here this evening in my capacity as the Vice Chair of the All-Party Group on Rare Disease at the Assembly. Thank you for the invitation to speak. And the All-Party Group on Rare Disease at the Assembly is an excellent example of partnering to advance the rare disease agenda with MLAs of all political persuasion in the north of Ireland coming together in partnership in recognition of the need to reduce health inequalities faced by the rare disease community. As some of you in this virtual call will be aware, the All-Party Group on Rare Diseases was established this year after some extensive campaigning and lobbying by the Rare Disease Partnership and members of the rare disease community in the north. And the campaigning began way back in January of this year, and I'm glad to share the All-Party Group. The All-Party Group met for the first time in October, with our second meeting planned now for early 2023. And the aim of this All-Party Group, which has a membership of 11 of the 90 MLAs of the Assembly, is quite simply to give a voice to the 117 people across the north of Ireland affected by rare disease at the Assembly. And before I move on to tell you more about the All-Party Group and the ways of working, I just want to add a bit of a disclaimer here now that I'm no expert on rare diseases, and neither are my MLA colleagues on the APG, but we are all very much aware of that work that needs to be done to reduce the health inequalities felt by a person diagnosed with a rare disease. We have learned that rare diseases, which are individually rare, when collectively taken together, they are common with some 110,000 people in the north of Ireland affected by rare diseases. It's therefore important that our health service supports this large and diverse patient population with the best possible care available under challenging conditions. Very simply, at each meeting, we, the MLAs, want to do a number of things. It is hoped that we could shine a spotlight on one or two rare conditions every time that the APG meets. It is agreed that this would help us MLAs further our knowledge and understanding of the issues affecting the rare disease community. And each meeting is intended to focus on current issues again to help us further our knowledge and understanding of the issues affecting the rare disease community things. At our first meeting, for example, we had an excellent speaker who shared how the cost of living crisis is having a major impact on the rare disease community. And again, Many of you will be aware of the Rare Disease Action Plan, which has been launched in March 2022 by the then Minister of Health in the North, Robin Swan. The launch of this action plan is strongly welcomed by the rare disease community with 14 clear actions over 4 main priority areas. 1, helping patients get a final diagnosis faster. 2, increasing awareness of rare disease among healthcare professionals. 3, better coordination of care. And 4, improving access to specialist care, treatment, and drugs. Now, the progress on the 14 clear actions is to be reviewed in April 2023, but as it's not accompanied by a budget from the Department of Health and has been driven by key stakeholders across the North, it's important to ask for updates on our part going forward. And if possible, the APG can use their influence to help keep on track and drive forward that particular agenda. We at the All Party Group will take opportunities such as events like this one to talk about the work of the All Party Group on rare diseases, and on International Rare Disease Day in February 2023 to raise awareness of the disease. For the information of everyone in the virtual meeting, the APG and Rare Disease Secretariat is provided by the Northern Ireland Rare Disease Partnership charity. And if after this evening, any member of the Northern Ireland Rare Disease community would like to raise an issue for consideration, they are initially asked to contact NIRDP. And I'm sure Adele Rogan from NIRDP could perhaps drop the relevant email address in here for information this evening. Before we finish, I want to share that one of the guest speakers at our first APG meeting in October was a young mother, Anne-Marie, who shared how she spends every day caring for her identical twin daughters who were diagnosed at birth with a rare genetic condition, PKU. I can't even pronounce the word, Panellists, I think it might be something along those lines, to protect them from potential brain damage. Anne-Marie shared that the only treatment in the north of Ireland to date has been a harsh and severely restrictive diet, which eliminates almost 90% of normal food from a PKU sufferer's diet and requires the regular, multiple times every day consumption of sticky, unpalatable formula to stay healthy and to grow normally. In particular, Anne-Marie asked the APG for help and support for her campaign for her children and others across the North for access to a life-transforming drug, Kuvan, which has been licensed since August 2021 and which has taken a long time to be rolled out to eligible patients due to bureaucracy in our health system. And we at the APG on Rare Diseases are offering our support to Anne-Marie, her children, and many others, and to raise the awareness of the challenges they face. And this actually brings me to a very relevant point, and perhaps one close on here, and it is that Anne-Marie was able to share that this life-changing medicine has been available in the south of Ireland for some time. Madness that people living only a few miles apart on the same island would have such a different access to life-changing medication. We at the APG are fully aware too that there are situations for others rare conditions in which the situation is reversed, and no doubt partnership working and shared learning across Ireland could be essential here. And we at the APG Rare Disease would like to wish our TD colleagues good luck in setting up their all-party cross-party group on rare diseases for Ireland, and hopefully the two APGs can work together to reduce health inequalities for all living on the island of Ireland that are affected by rare diseases. And I have to say too that even in my short time on that APG committee, that already it has enhanced my knowledge of rare diseases by the very people that I've met both on that committee and at the recent event that was held at the 10 years anniversary of the setting up of the Rare Disease Committee in Derry only last Friday. And I'm actually meeting with people who are suffering from various conditions, and already one can see, you know, that need of anything for an all-Ireland approach to all aspects and dealing with rare diseases, both in terms of that early diagnosis, in terms of the support not that's needed, and in terms of ensuring that no one is out there just feeling alone. So,
thank you, Maolíosa, and apologies for mispronouncing your name, actually. So Maolíosa is I've known many Maolíosas over the years. So, but actually, if I think we're just slightly ahead of schedule. So if I could maybe even ask you a question in relation to your own experience on that all-party group, in terms of its remit and what role it can play to not only, I guess, support greater awareness of rare diseases collectively, but then in terms of there's obviously a dedicated action plan that the all-party group has a remit over in terms of oversight and then accountability. Could you maybe give us a flavour of what that experience has been like as the vice chair of that group?
Well, given that we've only had our first meeting, and at that first meeting, we had two different people who are suffering from rare diseases, or in fact, the mother of the twins, and another lady then as well too, who described her condition and that to us, and identified many of the hurdles that she actually has been confronted with on her lifetime. And coping with her disease and so on, so that we as an all-party group are only but developing our own knowledge there, and that we'd hope that in doing that we will then be able to map the way forward to ensure that in this mandate that we will be able to address many of those issues, and that we would hope to, and I know very much so from my own perspective, because I live on the border and I can see entirely to that need, that for an integration of all other services and that as well too, and particularly in relation to health and so on. And that I look forward to the setting up of the group in the Republic, that where there'll be that type of communication and so on from our respective groups and cooperation within those two groups as well.
Thank you, Maolíosa. If I might ask Paddy, if in terms of the challenges of establishing the cross-party support for rare diseases, has there been anything that stood out from you in terms of what do you believe are the motivations behind politicians to mobilize behind rare diseases?
Yeah, I suppose there's a few things there, Derek. I suppose, like myself, my personal motivation for getting involved in this was twofold. One was I was friendly with John Brazel, who was the TD that formally proposed this bill back in the last government. And to be fair, John and myself would have chatted at length about it, and he asked me to continue the work now that he was no longer elected as a public rep. But secondly, I knew a family personally who suffered from amyloidosis, and there was the whole approval process and the reimbursement process there with I think Philip Quigley might be on the call as well. I think I saw her earlier. And look, that's how I initially got involved, is because I had a personal involvement with a family. But unfortunately, that seems to be what or what determines our action or inaction on this topic, which is not appropriate. Like, it shouldn't take for the fact that people personally come and lobby a politician, or the people ask you to put down a parliamentary question. It's for me, it's that kind of format at the moment which isn't conducive to progressing this issue. I think I might have told you a story once upon a time that I won't identify the politician, but I was sharing a speaking slot with somebody in the Dáil one day who actually went in to ask, from the southeast or southwest region, and who went in to ask about the availability of a specific drug, and just to protect his identity, I won't go any further than that. But after he finished speaking about a particular drug in a particular family, he turned around to me and asked me what was I speaking about, and I said, look, I'm speaking about orphan drugs too, and rare diseases. And he goes, oh, what's an orphan drug? And I just had to look at him and I pondered. I said, you just spent the last few minutes talking about it, and now you don't even know what it is. So they're the kind of hurdles that I experienced so far with it. I suppose how to keep it on the agenda politically. As I said, it was through my connection with a family friend and through John Brazel that kind of motivated me. But look, anybody that looks at this, even as a lay person from the outside in, you know, it's quite clear that the process that we have in this country isn't functional. And if it's dysfunctional to the point that I think it's dysfunctional, I have no problem saying that publicly, and I've done so repeatedly. What are we going to do about it? Because at the moment we have very little other than throwing a load of money at it over the last few budgets. And to be fair, that additional money that has come from Stephen Donnelly since he took over has helped, you know, approve more drugs in the last 2 years than previously. But we all know on this call that we're playing catch up, and money is only part of the solution. And for me, it's about the process, and that's what my bill deals with. And hopefully when this Mazars report is published in the coming weeks, that will hopefully unearth a few other pieces that we can, I suppose, untangle and improve the process that's there. So that's the motivation.
Thanks, Paddy. I'm going to push you a little bit more on that one. So so we've talked about the role and maybe the motivation of politicians, but indeed, for those of us who've been working on the rare disease policy end, and certainly the rare disease plan, the 2014 to 2018 plan, which was further extended, has been, I think, by anyone's estimations, has been slow. Has been, I think, by anyone's estimations. Thank you. So in terms of implementation of that plan and whose responsibility it is, for a piece of policy that was developed in partnership and in collaboration with patient groups and with a number of other stakeholders, we've seen from Northern Ireland how you can take a fairly large national plan in terms of the UK and the Northern Ireland national plan and turn it into an action plan. Is that something that you think that the cross-party group can help support, or is it that you feel maybe there needs to be a revision of the plan as such?
Well, I think under the programme for government, there's already a commitment that the plan will be updated, so that's going to happen hopefully. You know, it is there in black and white, and I'll be doing my best to hold whichever minister it is to account, you know, to deliver that. So rather from starting from scratch again, and you know, coming up with a whole host of new recommendations, many of which unfortunately have not still been enacted in the original plan, I think it's better to progress the plan that we have, review it, and just kick on with that. Ultimately, it's responsibility for the HSE, and you know, I think it was back about 14 or 15 years ago. Whichever Minister of Health of the day was there at that time, responsibility for this whole area was delegated to the HSE. So I do believe that we need to have more interventionist policy in regards to this. I don't think it's good enough to turn a blind eye. I don't think it's good enough, you know, to have, you know, a process at arm's length politically that you might be able to safeguard yourself. I don't think that's appropriate. And as I said, I've met with Taoiseach on a number of occasions about this issue. I've met with the Minister for Health. You know, we have to change the way we do things. We have to change our whole outlook on this, because what's there at the moment is not working. That's clearly the case. And, you know, as I said earlier, I don't want to make it all about drugs and reimbursement, because the care side of things, which I spoke about earlier, is equally important, if not more important. But you know, even from a layman's perspective, and that's all I am. I'm a school teacher by trade, so I'm not a medical professional of any shape or form. I can see what's not working, where we need to improve, and particularly when you do a comparison with our EU counterparts, we are so far behind. You know, it's actually scary to think that nobody has reacted at this stage, and alarm bells aren't ringing. You know, so I'm quite frustrated.
Well, I know that there's a lot of people on this call, Paddy, who would share your frustration, and I know that there's a lot of people who would be willing to get behind any politician who stands up and is willing to support the common rare disease agenda as part of that all-party group. And certainly, if anything is to be learned from Northern Ireland, is that once you get going, that's actually half the battle, is to get going and to get moving. And I hope that group meets relatively soon. We're going to move on with the next speaker, and I would like to welcome Alan Finglas. So Alan is the founder and the research manager of MSD Action Foundation. And Alan's son Dylan, who is now 10, was diagnosed with multiple sulfatase deficiency in late 2014. And promoting and supporting research that can lead to positive clinical outcomes for patients is something that Alan is really passionate about, and it's something that I know that he's been actively supporting and involved in. And he has helped to raise almost €1 million for research on MSD, and helped to attract an additional almost €1.25 million for funding on research. So it's very clear, Alan, that research is the source of much hope for your community, and indeed I think motivates you to keep involved and informed. Alan has been a member of the steering committee and patient board and the lysosomal disorders committee of the MetaBurn ERN since 2018, and is going to give us a perspective of those innovative approaches to healthcare that the ERNs are championing. Alan, over to you.
Hi, Derek. Thanks very much for the introduction. I'll just try and share my screen. Okay, can you see my screen?
Yes, we can now. Yep.
Okay, just minimize the Zoom. Okay. Okay, so I can give my perspective on MetaBurn being involved there for the last 4 years, and then kind of some general information about ERNs. So MetaBurn's goal anyway is to share care and cure. It tries to represent all patients and families affected by inherited metabolic rare diseases, IMDs. MetaBurn has 102 healthcare professionals and 47 patient organization members from 27 EU member states. The network follows about 60,000 patients. The network aims to provide EU-wide services aimed at improving the quality of life of patients and families. Sorry, my slide won't jump on. I'm going to have to. Sorry, guys. I'm having a freeze here. Okay. Can you still see my screen?
We can.
Okay.
We actually saw the last couple of things appear. Just I don't know what you were doing the last time.
Okay, we'll try it again from the beginning there. Okay, now it's showing. Okay, so connecting the most specialized centers in rare IMDs to promote prevention, accelerate diagnosis, and improve standards of care across Europe for patients living with IMDs. MetaBurn is entirely led by patients and experts, so combining patient experience and expert knowledge from across the EU captures the most innovative medical advances and tries to tailor them towards patient needs. This is a structure of MetaBurn. Every ERN would have a structure like this, and it would be on their website. So I'll skip on past that. You can check out any individual ERN yourself. ERNs are funded by the European Commission, and ERNs are accountable to the Commission. Each ERN has a funded coordination office. And for me, they're very much a trusted partnership. If they're not a trusted partnership, I don't know what is. And MetaBurn in particular are also endorsed by SSIEM, which is a group of clinicians, that's a Society for the Study of Inborn Errors of Metabolism. So they're made up of healthcare professionals and patient organizations. So each patient organization would put forward one representative. So patient reps and HCPs are deemed to be equal. And I think this is really important to kind of have good collaborations in the best interests of patients. So there's typically a patient board, a steering committee, and a medical executive committee. And then there's also subnetworks, which are disease groups. In Metaburn, there's 7 different groups, and there's also work packages. So you would select one subnetwork and one work package. Usually it's difficult, or say almost impossible, to go into different subnetwork groups, because when there's AGMs or different meetings, they often clash. Specific disease group meetings clash, so it's difficult to be everywhere. So patient organisation reps can influence the work of ERNs, but often this can only be done from within the ERN. So I think it's important to actually be a member, or to try and have some involvement. Patient organisations can join an ERN right away. There is no requirement to be an EPAG member with your orders. I think this is a common misconception. So if you were thinking of joining an ERN, I would say, first off, does the ERN fit with your goals and your capacity? I would say to any patient representative who is thinking of getting involved, to go to one AGM and see for yourself, try and get an idea as to how it works. But it's taken me like a few years to get really a really deep understanding, and even trying to see where we can do better. So I think there's more and more possibilities for collaboration on more disorders when we have more members, like more patient reps and more HCPs. Some funding is available to help patient organisations to travel. It might vary from one ERN to the next, but for in-person meetings, and there's 2 offerings this year for me out of 3 meetings for funding for travel and accommodation to attend meetings in person. So I think harnessing the interest of the members within the network is really important. So, you know, if healthcare professionals are interested in certain disease areas and patient reps are also interested in those areas, it's difficult to kind of look outside of that to begin with. So these ERNs cannot necessarily do everything for every disorder, but so I think, again, you know, being a member is important, that you have a chance to kind of influence their work. So consensus clinical care guidelines documents are possible within ERNs, especially where none already exists. And then natural history studies and other clinical studies are possible. Metaburn recognises an EU-funded patient registry called UIMD, and it is the greatest collection. It has the greatest collection of patients with IMDs. It has an institutional home in Heidelberg University, and this is funded by the EU health section as well. So ERNs, from my experience, you can work at your own pace. You don't need to attend every in-person meeting or online meeting. Probably few people do. And you can still make an impact without attending everything. There may be other patient reps in the network that represent your disease area, and this I've already seen. It can really help collaborations that can be fruitful within the network when there is more one representative per disease. So I think it's important to note that healthcare professionals and patient reps are volunteers. So there are limitations to what we can do. So activities within ERNs tend to be slow burning, but I definitely say better to be in than out. The second year cycle of ERNs has just begun, and there is definitely more of a focus now on impact. Because of the divisions into seven different disease groups, it's impossible for me and others to try represent multiple disease areas in any one ERN. Inter-ERN collaborations are possible from within. So collaborations from one ERN to another. So it might be Metaburn collaborating with Ithaca, which is an ERN for neurological disorders, if there's a common interest. And that's kind of promoted. So ERNs, from my experience, there's great networking collaboration possibilities and publication opportunities with the number of HCPs and member states. And these connections and this networking with these groups of people could be really important in the future for patient organizations and ultimately for patient benefit. Not all publications from ERNs are disease specific. We had a really good survey. It went out to 900 people. I helped to develop the questionnaire initially in English to try and get it right. And then it went into like 12 different languages or possibly more. So that was on the social support needs of patients with IMDs across Europe. And I think the findings are very interesting and could be leveraged to try and fill gaps across Europe. These are really important, and it wasn't a huge burden for any one person to do this job. I joined the lysosomal network, as I've said, our Derek has said. So from my Metaburn collaborations, I was directly invited to write my first lead author paper on MSD in JIMD journal. And this opened a lot of doors for me and for MSD. And I think the paper has helped patient families and HCPs, not just to understand the patient, caregiver and patient advocate journey, but to try and do much better for patients. And I underline this much better for patients because this is ultimately what we're trying to do in the ERNs. It's not necessarily all about the disease you represent. It's trying to do good all around. And yes, if you can get any benefit for your condition, yes, absolutely take that opportunity. So that's all from me.
Thanks, Alan. It's clearly been a very fruitful time in the ERN for you as an advocate, but also for your organisation and for your for other patients and families. I'm struck by what's coming through the chat, and I might just pause you for a second for a question. And it's around, so there's a good deal of discussion in the chat about care pathways and how care pathways can be. And I certainly know from the work of Anne Lawler, and indeed I see Lorna Kieran on the call as well. But in terms of care pathways being that kind of clinical and advocacy tool to facilitate, I think, more specific direct care for individual conditions. And you talked a little bit about the consensus clinical guidelines that's available through many ERNs, and it's possible to develop these. What do you think are the challenges of actually bringing these at the national level to give that more specific care pathway development?
Yeah, it's a great question, and it's something I brought up within the ERNs before. Like if, say, for example, Metaburn developed a care guidelines document for MSD, and it's published, and it's, you know, a very good consensus. It might be the only guideline for that condition, but then you try and roll that into different countries, and sometimes there's a resistance, you know, and that's really sad, because that's not what we need. We need a mechanism where every member state who's a member of an ERN has an obligation to take on that care guidelines document, especially in the absence of any guideline. I think naturally, if there's no guideline, most healthcare professionals would refer to it anyway in the absence of having a tool to refer to, but definitely needs a recognized, and there should be no resistance. And this is something we need to work on. It's a big job though.
No doubt. I'm going to ask Caitriona Creely to join us. Thank you very much for that, Alan. It's been a great presentation, and I certainly hope we can share the slides with everybody afterwards. So Caitriona is from the Health Research Board, and she's leading on the data infrastructures and personalized medicines portfolio at HRB. And I know that you're part of the organization of the HRB's national conference later on this week on personalized medicine. So best of luck with that. So Caitriona has experience in developing schemes to support health research, including clinical trial infrastructures and trial funding, and has managed funding partnerships with national and international funders. And through the work of the Health Research Charities Ireland, she works closely with Avril Kennan and the HRCI team. So Caitriona is currently HRB's representative in the European Joint Programme on Rare Diseases, and is a member of the Strategic Research and Innovation Agenda Task Force, which is for the planned European Partnership on Rare Diseases. And we've asked Caitriona to just give a brief overview of both of those last initiatives that I've mentioned, plus also her perspective of working from a HRB perspective at that national level in terms of promoting collaboration. So Caitriona, over to you.
Thanks very much, Derek. And I've got a great kind of lead in for some of the things I'm going to talk about, because Alan has talked about on the ground what the European reference networks have been doing and what they've delivered on. Just to say, in terms of the agency that I work for, because we talked a little bit about partnerships and partnering with different sectors, just to say the Health Research Board in the main funds into universities and hospitals, so not involved directly in industry partnerships. I've also had the pleasure to work on the Clinical Trials Network scheme, which recently made an award for Trials Network in Rare Diseases, which was launched earlier this year on a Rare Disease Day. And just you mentioned the joint funding scheme with HRCI, and I see Avril is on the call as well. Because this is a forum that's cross-border, I just wanted to mention, and Vicky McGrath from RDI thought it was important to mention maybe that participants from Northern Ireland are also eligible to apply to the HRB for funding through investigator-led projects and through the joint funding scheme with HRCI. But I'm going to talk about 2 European initiatives that have relevance for rare disease patients in Ireland. I'm going to present some information on the proposed European Partnership on Rare Diseases, which is intended as a kind of a follow-on initiative to the active European Joint Programme on Rare Diseases. So HRB, through myself and the National Rare Disease Office, Professor Eileen Tracy, are both represented in the current joint programme, which began in 2019 and has a funding of over 100 million attached to it, with 55 million coming from the European Commission. So this current partnership, which runs to the middle of 2024, aims to, there's kind of 4 main key areas. There's providing funding for rare disease research, and that's in the main to multi-country research projects. Through a virtual platform which is in development, they want to provide a single point of access to be able to discover and query and eventually access in a safe way patient registries, biobanks, genomics repositories, and other resources in a coordinated manner to facilitate research and in particular diagnostics and therapeutics development for rare diseases. There's also a branch of the joint programme which deals for mainly training and education for different audiences. I'll come to health literacy in a minute, for clinicians, for patient representatives, for PhD students, for bioinformaticians. And then finally, they aim to have a research translation support and also a clinical trial support. The joint programme doesn't directly fund clinical trials, but the aim is to link up researchers with, say, for example, a network that can help them source funding and to move into clinical trials. So there's a huge focus within the current joint programme on European reference networks, and actually each of the ERNs, there's 24 of them, are partners of the joint programme. And Alan has spoken about those. And in addition to the kind of the healthcare perspectives and the education, they also have a kind of a research component of those. Ireland to date has had limited ERN membership, but just to say this year 15 new sites were announced in Ireland, and that should provide a much larger platform for collaboration across Europe. So in terms of time, the European Rare Disease Partnership is planned to begin in the middle of 2024, so it's in planning at the moment. While the current joint programme is limited to public sector participants, the partnership is planned to expand to involve the European Commission, first of all, as a partner, the member states, patient organisations, but then also industry. And this is a little bit of a question of how that partnership will work and to what extent there are other models out there, such as, I don't know, Innovative Medicines Initiative, which could provide a kind of a model for partnership. So the partnership will continue and extend the research funding and also those implementation of the other supportive activities like training, but also maybe with a focus on healthcare professional literacy, the abilities of other healthcare professionals to potentially recognise when there's a rare disease as a potential diagnosis and refer people onwards. Also to look at data infrastructures for managing the huge amount of data that's produced about people, but it's often locked away and separated and fragmented. And then data standards as well. And I'll talk about ORFA codes in a minute. Importantly, the intention of the partnership is also to coordinate much more at a national or local level the research and innovation programs that are going on, and to provide support at a national level to establish national mirror groups to coordinate activities around rare diseases, and also to support refresh of national plans and strategies. The kind of the currently out of date national plan was mentioned. Ireland is not the only country that's in a similar state where it hasn't been renewed, and there's going to be a push in the partnership to support and to drive and to help with, I suppose, implementation plans, not only having a strategy, but having an action plan and a budget attached to this, as Maolíosa mentioned earlier. So the partnership will involve larger amounts of funding for research and research supports. The main goals of the partnership are aligned with the International Rare Disease Consortium in the main, in that diagnosis would be established, or subject to systematic research within 6 months of a person coming to medical attention. That 1,000 new therapies for rare diseases are approved. As I said, this is part of the International Rare Diseases Consortium. But also, thirdly, that there will be better understanding of the impact of rare diseases on patients, families, and on society. And that will include the economic impact and others on society of having people who are maybe not, who don't get access to diagnosis, or don't get early access to therapies, or don't get appropriate care when there is care that they possibly could have access to. The vision of the new partnership is to leave no person behind, and it has the ambition that also every rare disease patient willing to participate in research is findable for a study. So just in terms of timeline, the research agenda is currently under development, and next year the consortium of partners will set out the proposal for the new partnership in detail. I mentioned Professor Eileen Tracy from the Rare Disease Office, who's also participating in the joint programme on rare diseases. She can't be here tonight, so I'm going to present some slides on behalf of her team. Thanks very much. So you have those up, Claire. So just first of all, I think, Claire, if you can just have the first one on the ERN. So talking about those European reference networks, a joint action, so basically co-funding provided by the European Commission, is going to start next year. And the Department of Health has nominated the HSE as the competent authority for Ireland to get involved. The aim of this is actually to integrate the European reference networks into the national health system. So there's one thing to nominate a centre and say you're an ERN, and there's another thing to say, well, okay, how does that work? How does that, what's different now? How is this actually part of the care pathways within Ireland? So the 5 acute Irish ERN leading hospitals, that's Beaumont, Children's Health Ireland, the Mater, Tala, and St. Vincent's. So this support is going to help them carry out their obligations. So being able to refer patients, develop rare disease registries, develop care pathways, and then also to be able to engage in research, clinical trials, and also education and training activities. What would this mean for people affected by rare conditions? The work should improve access to European Reference Network for RD patients. We haven't really spoken about that, but I think the vision is that you're able to access, so information travels, not the patient, you're able to access this expertise, clinical advice, and hopefully this will facilitate diagnosis, treatment, and follow-up of patients within the RNs, but without the patient having to physically go to another country to access this expertise. Also, the work funded will develop patient care pathways. This has come up in the chat already. You'll be aware of the Care Pathway project in progress by the National Rare Disease Office in the development of 30 care pathways in collaboration with patient organisations. And the NRDO, in collaboration with the clinical leads from the participating hospitals, will have a key involvement in this section of the work. Also to develop care pathways for undiagnosed conditions where a diagnosis cannot be found at national level. And then the aim is also to improve signposting of expertise in care pathways, including those that are not covered at a national level or with the ERNs that we're currently members of. So we're currently members of, I think, 18 of the 24 European reference networks. Could you advance the slide, please? So we're on the Orphanet, yeah. So the second grant that Ireland is going to participate in is one specifically to support Orphanet data. So to implement OrphaCodes, which is recommended by the European Commission as a rare disease coding system. That's one of the outstanding recommendations of the National Rare Disease Plan. So the idea is that OrphaCode will actually capture 100% of the rare diseases. So rare diseases and people affected by the rare conditions are actually visible within the healthcare system. At present, the health system can't accurately collect or report on rare disease data. For example, during the pandemic, people who were at high or severe risk from COVID-19 weren't easily identified. Other coding systems, such as we have ICD-10, I think at the moment in Irish hospitals, even though we're supposed to, I think, have ICD-11 already, but it only captures 58% of rare diseases. So a national audit carried out showed that Irish GPs are using a variety of healthcare coding systems and are they're not coding rare diseases in their practice. So in order to speak for people with rare diagnoses, we have to be able to, first of all, track and count those with RDs. ORFA code has been recognised as the most appropriate coding system of rare conditions in Europe in a recommendation from the European Commission expert group on rare diseases. So ORFA code is part of being able to support that European reference network integration into the Irish healthcare system to improve cross-border specialist care, having that the information travels, not the patient. So thanks for that, and thanks to Geraldine Sweeney from the NRDO who prepared the slides.
Thanks, Caitriona. My own background is in European level research infrastructures, and Caitriona and I know each other well from trying to further the cause for national investment in European initiatives. I'm just wondering, Caitriona, what does success look like from a national perspective in terms of involvement in particularly the two European initiatives that you've talked about? These are new European initiatives. They're coming down the tracks, and we're already involved. Are there particular outcomes that we're looking at from the national perspective? That you've mentioned the identification piece is obviously something that needs to be addressed. But are there particular goals that we're setting at the national level from involvement in these, and what kind of goals are they?
I think, and I can only speak from the HRB perspective, obviously other partners will have other specific goals, and I think that's right and proper. For us, it's to be able to enable research. Now, with rare diseases, research and care are so tightly connected that in the areas of diagnosis, for example, they're really kind of operating side by side. But I mean, for us, data is a big part of it, to be able to establish systems such that we can connect across Europe. Because I mean, Ireland and rare diseases, we're such a small country with a small population. We really have to work in concert with others. So the data is one part of it. So the virtual platform that's being developed, and also looking at standards to be used. In a way, I mean, this is sometimes when you look at things, if you're less developed, maybe trying to integrate with others maybe can be in a way easier, because you can just kind of move on a couple of steps rather than trying to kind of change over from an older system. But I think the data to make people findable. So, you know, I'm also working on 1 million genomes, and we've just kicked off a new project for genomics data infrastructure for Europe, which is a really positive development. That's co-funded by the HRB as well, and shortly there should be the national strategy for genetics and genomics as well, which would be of keen interest to the rare disease, to many in the rare disease community as well. But they have rare diseases as well as cancer for kind of use cases to see, you know, if you're sitting in Finland and you found a variant of interest, what can you do through federated access? So the data stays in the country, but you're able to safely interrogate it, see what's there, see kind of clinical or phenotypic information about a patient, and being able to make, through that, make diagnoses essentially. So the partnership is what's nice is the partnership is going to pull in some of the kind of larger projects like Solve RD Connect, which were kind of funded as individual projects by the European Commission, but it's going to pull these in a little bit and try and kind of move forward together. I think what I see obviously in the rare disease community is some of the concepts that kind of, you know, people are getting to grips with, like FAIR data, like open science. It's really critical. It's really focused in terms of what they're for. Like, it's really clear what this is for. This isn't a, you know, like, wouldn't it be nice to have open research? It's like, well, actually, we need it. Thanks very much. Otherwise, there's no other way to get the data that we need to develop this or to get a diagnosis. The other part I think is really important, and a number of people have mentioned it already on the chat and so on, is the better understanding of the impact of rare diseases on the life of patients, families, society, a better understanding of the economic impact, some of the discussions that are happening around reimbursement. You know, if you're not taking into account lost, say, for example, work days and so on of people caring, you know, are you actually totting up what the costs are and so on. So there's lots of, I I think those are two probably key things that would be goals for us and that will be aligned with our kind of HRB strategy. And the other thing is that other awards that we've made, such as in kind of clinical trials and so on, that those networks will be connected into a much wider European network. So we'll be able to leverage the connections that are already there across Europe. So I think there's, and I know Cork started off with kind of a less optimistic view, but some of the things I'm seeing behind the scenes, and I mean, it's great to hear that the Oireachtas committee is going to meet very shortly. It seems like there's a kind of a timeliness and an opportunity, and the Commission is pushing this, as you say. These are new grants like the ERA, the implementation grants, the ORFA code, and so on. The European Commission is really trying to push to get countries some way level the playing field, some way. I know Ireland has a lot of catching up to do, but any of the comments that, and there are some other people I've seen on the call who have been at some of these meetings in terms of preparing the European partnership, the idea of health, addressing in some way the health inequalities, the solidarity aspect of trying to bring countries up to a higher level and not have just so many countries kind of playing catch up to some of the larger countries like France, Italy, the UK, and so on, who are well ahead. That's a very long answer for you, Derek.
No, it's a great answer, Caitriona, because it actually brings up more topics that I'm hoping that we can discuss, and certainly if I talk about that topic of how to motivate politicians, it does kind of bring up the question from my side that it does seem that rare disease policy is not falling under the right ownership right now, and I'm responding as well to the chat in terms of how health and social care aspects need to be first of all, the needs need to be identified and then addressed, and that sometimes is not within the remit of the Department of Health. But then in terms of the role that politicians can play, and Padraig, I might turn to you just in terms of that positivity around rare diseases. That certainly I've been working in this field for over a decade, and I don't know any other area that's as innovative as rare diseases in terms of either individual groups doing individual for their conditions, or groups working collaboratively together. You have to work collaboratively in rare diseases, and that's where an awful lot of the motivation comes from, but it's where an awful lot of the impact is coming from. And it seems to me that there are incentives coming down from Europe that would help mobilize greater resources and greater capacity and capability in Ireland, and that it's actually a question of matching those kind of broader European objectives with what the goals are at the national level here. And if we can combine our efforts together, those goals can be quickly identified and action plans can be developed. So it is an exciting time for rare diseases, and there's many of us who are on the call who are equally motivated to get moving on this quicker. I just wonder what your perspective might be in terms of maybe harnessing that collective action at the national level, and how we might speed things up.
Yeah, and thanks, Derek. And I suppose, look, that's initially why we're establishing the cross-party committee, because there literally is unanimity amongst my colleagues in the Oireachtas that this is an issue that needs to progress, given the fact that it was so starved of resources for so many years. So Caitriona's right in that sense. There is progress that's being made that is exciting. It's constantly innovating. I remember the time we published my bill, I was on the floor of the Dáil more or less stating that this is already obsolete legislation because such was the innovation that was happening in this field. So it's constantly progressing. But I suppose, look, to get politicians motivated in this, I was kind of giving from my own perspective that's how I, became engaged with the issue. It was just that person literally turning up to your clinic or, giving you a phone call. It was that basic. But as for, a more coherent, collaborative approach amongst the wider body politic at the moment, save that cross-party committee, that will hopefully be the first step of something, into the future. But like, even my legislation is stuck currently at stage 3 in the Dáil, so it's due to come before Health Committee. So that's something that we need to unblock. I've written to Sean Crowe, who's the head of the health committee, to hopefully do that early in the new year to allow it to progress. But look, there's no doubt that there are innovations here that are exciting. And when I sit down and talk to people in the whole area of genomics, it's incredible the stuff that is coming down the track. But I think we just need to be cognizant of it, that literally every drug, as Caitriona said, that's going to be manufactured going forward for niche cancers and so on, they're essentially all going to be orphan drugs, possibly, or rare diseases. And that's something that I don't think the template is right at the moment in terms of our reimbursement of that. And I know that we've had some success, as part of the Benelux arrangement most recently, and that's encouraging. We need to see more of it, and we need to see more of it an awful lot quicker.
Thanks, Paddy. If I might actually just on that topic of new innovative medicines, and certainly in terms of, well, reading Tony O'Brien at the weekend in the Business Post calling for an entire review of the entire system, it does seem that slowness is to a certain degree accepted, and that we do need reform of the system, and perhaps your own bill can play a major role in that. I'm just wondering if you've taken kind of any examples from other countries who have done this in that different way, or if there's a particular approach that you've learned the most from.
Yeah, there's a number of examples. Look, probably the most interesting one for me, we had a number of health professionals from Denmark call. It was about 3 months ago, and they essentially, they were actually coming to learn from Ireland on how we do the manufacturing side so well. And they found it mind-boggling, the whole side of reimbursement and the way that we process each application. So while in a European context we are leaders on the manufacturing side, on the research and on the whole area of reimbursement, we are laggards, and that's well documented. And I suppose they came to learn about the manufacturing side of things, but learned, that, or why we were so good at doing one thing, they found it quite difficult to comprehend why we were so far behind on the other. So I found it, the fact that Denmark, it's essentially it's a Sláinte care type model. It's virtually an entirely public health system, but they have a lower GDP spend as a percentage of overall health spend than we do, and they get far greater access to drugs in a timely fashion than we do. And they engage in risk sharing and so on, and other innovations with industry in that space. And I think that's just one example. I know in Scotland as well that they have more or less early access to drugs, more compassionate access to drugs, as they do in Sweden. So these aren't France and Germany. These are countries with a comparative population to our own, economies similar to our own. So we can learn from other countries. If they're coming here to learn about best practice here, we can learn from best practice elsewhere. And I think that's something we need to be innovative about.
Thanks, Paddy. I might turn to Alan. So in terms of your work with the ERNs, Alan, Caitriona mentioned a lot there about the importance of data and data moving and patients not. Is the data maybe being collated within ERNs? Has there been any discussions in ERNs in terms of moving that up to a level where it can be high quality data that can inform, for example, assessment and reimbursement processes? Is that something that's been discussed at all at that level?
Yeah, good question. I suppose what you're kind of getting at is like the likes of patient-reported outcome measure studies, or maybe caregiver preference studies or something. It's kind of a process of getting to this, and I think these are kind of down the line. So if you take, for example, that UIMD registry in Metaburn, well, it's not part of Metaburn as such, they collaborate, it's in Heidelberg. There was a group, 2 patient advocates in particular, representing a rare condition, a rare IMD called SLO syndrome. And they were really proactive in getting patients with this condition to enroll in this patient registry. And then from there, they tried to build on that and they're trying to work on a natural history study, But I think, you know, parent-reported outcome measures is something they want to do, but it's kind of down the line. It's not a primary, but the ERNs are talking about this. But, you know, we're probably years away from doing this across multiple diseases. But there's definitely opportunities to collaborate and do these kind of studies. You know, funding always helps. And if there was funding, regardless of where it comes from, I think the ERNs eventually will need to have a good mechanism to see how they could collaborate with industry, for example, and still be a trusted partnership. So yeah, there's potential here. If there's a good appetite and possibly some funding, yes, you can get a lot of things done quicker. And it's a fabulous network to be able to leverage these things. So it's possible, but it's step by step, I think.
Thanks, Alan. There's some questions in the chat that I'd like to ask of Caitriona. So, Caitriona, there's questions here that relate to patient organization involvement in the rare disease partnership, if that's something that is planned, and if you can tell us a bit more about. And then there's also a question around rare disease patient registries. So obviously this is another area of the rare disease plan that hasn't been implemented, but I know that there's discussions on about use of the term virtual registries in the hospitals that have been appointed ERN status in Ireland. So is that something, either of those, you can talk about?
Yeah, I think it's definitely going to be a question. There is definitely going to be patient organization involvement in the partnerships. I have a question in my mind about the mechanism through how that's going to work. And I think we've already made the case, myself and other people from Ireland who have so far provided any inputs, that there would need to be funding set aside to facilitate this more. Not every country is able to provide money for public and patient involvement in the way that there are pockets of money in Ireland, for example. I was glad to hear that the EPAG does have some kind of travel and supports available, but not everyone does, as I understand. So that's a gap at the moment. So it is to be able to recognise patient advocates and patient representatives' time and expertise to participate in activities. So that's foreseen. It would probably be more at an association level. The other question then you asked, sorry, and I'm getting distracted because I was scrolling up to the chat, was which?
It's a question from Lorna Kieran, and it's in relation to rare disease patient registries.
Yes.
So how? Yeah. Go on.
Yeah, I think I don't have so much information, Lorna, about the virtual platform and how that works and the mechanism of how you would be able to query various registries. But I mean, what's clear to me is that there would have to be some kind of let's call it an onboarding mechanism. They're taking this approach in the Genomics Data Infrastructure Project. There are onboarding countries, and then there are operational countries, and onboarding countries are still thinking about kind of standards that they need to use and how to interoperate with other registries and systems so that someone would be able to look in and query your data and so on. So while I don't see there being kind of supports at a national level to fund new registries, I certainly think that there could be supports to facilitate being interoperable with a wider system. And that's something that, I mean, there's other people on this call here who have kind of more kind of ideas about and so on. And I know that the Clinical Trials Network in Rare Diseases that Rachel Creely and Cormac McCarthy head up have been thinking about this and how they can interoperate with what's going on in Europe. So I think it's definitely seen as a piece of the puzzle. I think a lot of it also is maybe, not all of it, but is taken care of by the European reference networks. And that's why participation in the European reference networks is going to be such an important part of how we get the best benefit out of the partnership for rare diseases. But I'm happy to follow up on if there's other questions, because I see there's other people have dropped questions in, so follow up afterwards as well.
Yes, I should probably clarify. So we're going to, any questions that we're not able to maybe address on the call, or we will be following up with either the individual speakers or indeed whatever information we're able to glean ourselves, and to share that through our social media channels, if publicly, if the answer is publicly available, and So please follow us on Twitter, and that applies to any of the Rare Disease Forum organizations. We do have a couple of questions coming through. There's one from Avril Kennan, actually, for you, Caitriona. It's in relation to the European Partnership and how it might help to refresh and implement our current rare disease plan.
Yeah, I think that would be in the context of having resources available, people on the ground available to support whoever is kind of leading out on it, or if there's a team and so on. Again, as an example, I mean, I think at this stage the partnership is still at the point where you can put ideas in. So I'm just seeing ideas that are coming through here as well. And I mean, that's really useful. There's still inputs coming in. I think it would be in the terms of human resources to support, either depending on where a country is, supporting development of a strategy or supporting development of an implementation plan. I suppose in the same way that the Department of Health actually engage consultancies to support a speedy development of a national strategy for genetics and genomics. And Portugal is undergoing some similar work at the moment, again, supported by the Commission through a particular mechanism. So I think it's in terms of human resources to be able to put a plan together so that it is likely to be implementable.
Thanks, Caitriona. I'm struck by a comment that's in the chat, and before I bring, maybe Padraig Toland is there from the NIRDP in Northern Ireland, and Padraig has a really interesting comment, but I'm wondering, Padraig, if you might be willing to unmute yourself and tell us a little bit about, I mean, Caitriona talked there about the human resources, but you're developing patient resources to help those living with rare diseases to record their experiences and to be able to share it with professionals. Is that correct?
Hi, Derek. I won't put my camera on because you'll see me under multiple layers of clothes and blankets with the freezing temperatures here in the north. But yeah, it's something myself and Adele in the partnership have discussed and are thinking about for the coming year. Maybe some forms of electronic or paper-based resources where a rare disease patient can maybe document that story of their journey in such a way where it can be shared with others in a way which doesn't re-traumatize them or make them or compel them to revisit things from their past that don't feel to them in the future or in the present something they want to talk about at ease. So it's something we can kind of keep people abreast about as we kind of bring it to the fore. But it's just interesting, Lindsay mentioned that point in the chat, linked to what we're maybe thinking of brewing in the north. And that's the point of these meetings, to get together, to share, and to learn what we may be doing in isolation so we can spread that practice even wider.
Thank you, Padraig. That's an excellent point, and I think just re-emphasizes the point of the need for greater, I think, information sources in terms of cross-border information, but then also the example of the forum. So the forum is both for information and for connections and networking, and it is certainly something that there's a huge unmet need there from a rare disease patient community, and it's only through the likes of the efforts of ourselves and the equivalent in Northern Ireland that we've managed to bring this group together. But if we were to think about and maybe raise our own ambitions for what other aspects we can focus on, that can lead to greater applications for research. I know that certainly the Shared Island initiative is something that the rare disease community is looking at. And before I turn to Vicky McGrath to give us some closing remarks, I'll just ask people to just check out the chat yourself. There's a link in there to a Mentimeter survey, and I would just ask everybody if you could, there's just 2 quick questions that we're asking people to complete, just in terms of both the Republic of Ireland's national plan, and then a further question about what if you were Minister for Health, and Paddy alluded to the fact that there might be a change, but we won't know for sure until maybe 2 weeks' time. But I think if everybody has an opportunity to say what they would prioritize, and we can display those results in our outcome report, which we were able to turn around quite quickly after this. So Just before I turn to Vicky as well, there will be in the chat, there'll be a short survey in terms of your experience of this event. It's really important for us in the Rare Disease Forum to know what the quality of these events is like for people, what the experience is like, and what other topics we can possibly be focusing on that have either come up tonight, or maybe more importantly, that have not come up tonight. So please feel free to click on the link to the Survey Monkey. It'll be coming in the chat shortly. So without further ado, I'll hand over to Vicky McGrath. Vicky is the Chief Executive of Rare Diseases Ireland and is going to close this evening's proceedings. Vicky, over to you.
Thank you very much, Derek, and thank you to all of your team at IPPOSI for helping to organise, or for organising this evening, not even helping to. And thank you very much to all of the speakers. I will have to say my head is wrecked. I guess the flow of conversation, the ideas, the challenges, the opportunities are just multifold. Just enormous. I think the one thing I would maybe take out from what we have heard so far this evening is that in spite of our frustrations at how slow everything is and that we don't seem to be making progress, I feel that we are beginning to. I think that there's a slight reason for optimism. I think Caitriona speaking there about the ORFA codes, and that has been on the agenda for years and years and years. And maybe we're beginning to get there. And the amazing thing about something like ORFA codes is it means that we can start to count people. We can start to understand what is the scope of this, where, what is really going on. And I think that's our biggest challenge, and not just a challenge for us as a rare disease community, but for the leadership in the HSE, for politicians, for everybody. It's kind of like, what is the rare disease community? How do we, I guess, what is the scale, what's going on? So it's really critically important. I'd have to say, just in terms of partnership, sorry, I have somebody awake here. Stephen, please keep quiet. Just in terms of partnership, I can't underestimate or understate how critically important it is that we do all work together. And I think that, we're growing to recognize the value that patients bring to the table, patients and the caregivers, that actually what they are saying is not to be discounted, that it's incredibly important, some of the information that the people are bringing forward. And it's not just the value about, it's not just listening to what they're saying, but, engaging with them and getting them to help you to bring things forward as well. The work, say, that Alan is doing within the ERNs is quite incredible, and I think there's an opportunity for all of us to start to engage at those levels, those that have the time and the opportunities of, or the times and the desire. But there is lots of areas for partnership that we all need to, I guess, investigate and engage where we can and try and build on what has happened so far. There is a lot going on. There's a huge amount that remains to be done, and really, it is critically important that we all make sure not alone that our voices are heard, but that our actions are felt, that we, I'm afraid to say, that we carry some of this and we push it over the line, that we don't leave comments at a table and hope that others will take it over the line, because I think history tells us that's probably not going to happen. And so we need to push a little bit harder and help to raise or to get everything over the line. I guess one of the things that came up earlier on was, when Derek asked Caitriona, what are the goals for RD partnership? What's the ultimate aim, or why are Europe invested in this? And I would have to say, from my perspective, from the perspective of RDI, and I think from the perspective, I would hope, of many of the people on this call, really what we are seeking is equitable access to care. And that might be a drug, that might be a particular therapy, that might be a speech and language, it might be an operation, but that everybody has an equal opportunity to get access to the type of care that they need. And I think Europe is very invested in ensuring that everybody across Europe has access to that type of care. And then equitable access to research. Research is not for everybody, but research will be for many, and it's to ensure that we all get the access that we may or may not want to that research. So, you know, I guess equity, equitable access to care, equitable access to research. That is the goal. That's what we're driving towards. And I think through partnership, we can make strides in that direction over the coming years. Thank you, Derek.
Thanks, Vicky, and thanks everybody for joining us. We're just a minute over time, so fantastic to actually run an event to time. So with that, I'll give the rest of you, everybody else, the rest of their evening back. And I know it's not really the time to say that, but I do wish everybody a very peaceful season's greetings in terms of December and all that it promises to bring. So well done everybody for helping out this evening, and we will be certainly back in touch with everybody in the new year with more Rare Disease Forum events and actions. So thank you again.